Breast cancer is the most common cancer diagnosed in women. It is the second most common cause of death from cancer among women in the world. Breast cancer evolves silently. That is why it is so important to catch the bastard as soon as possible. In today's episode, let's talk about breast cancer awareness. My name is Kate and welcome to my channel. Who is at risk of breast cancer? First of all, women. 99% of breast cancers occur in women. The second factor is age. Breast cancer most often occurs in our 40s, 50s. Also, research indicates that approximately 25% of breast cancer cases may be related to gene mutations. There are also some behavioral choices that increase the risk of breast cancer, and these are lack of physical activity, drinking alcohol, smoking tobacco, lack of breastfeeding, using some types of hormonal therapy, and troubles with weight control. But even if all the potentially modifiable risk factors could be controlled, this would only reduce the risk of developing breast cancer by at most 30%. Still, half of breast cancers develop in women who have no identifiable breast cancer risk factor other than gender and age. That is why, ladies, we should test ourselves. First, you need to know the symptoms that may indicate breast cancer. These are nipple turning inward, nipple discharge, lump in the underarm area, swelling of part of breast or swelling all of the breast, skin dimpling, breast or nipple pain, and skin irritation. And here a small note, if you have any of these symptoms, you don't necessarily have breast cancer. These are just symptoms that may be associated with breast cancer. Breast cancer foundations and healthcare programs around the whole world encourage women to do self-examination at home, usually once a month. Self-examination is, of course, about examining our breasts ourselves. Start in front of a mirror and visually inspect your breasts with your arms down, to the sides, and high overhead. Look for any changes in the shape, look for dimpling of the skin, swelling. But please remember, left and right breasts will usually not be the same shape, and it's absolutely normal. So instead of comparing your breasts to one another, look for changes in one breast. The second stage of examination is palpation. You can do it while lying down or in the shower. Place one hand behind your head and examine your breast with the other hand. Make circular movements, movements towards the nipple, and up and down movements with the fingertips 2 to 4. Of course, you will feel natural spongy tissue thickening under your fingers. What should worry you is a distinct mass that's noticeably more solid than the rest of your breast tissue. It is very difficult for women to distinguish healthy tissue from a lump. And this is the reason for many discussions about the validity of using this type of diagnostic method. On one hand, we have studies showing that despite increased use of screening mammography, still a large percentage of new breast cancers are detected by patients themselves. On the other hand, American Cancer Society no longer recommends doing breast examinations since they found a moderate evidence that it increases the risk of false positives, which is a woman finds something on her breast, she's scared, so she's doing a mammography, and it turns out to be a healthy tissue. So in theory, she performed an invasive test that she didn't need. Still, according to American Cancer Society, women should be familiar with how their breasts normally look and feel and should report any changes to a healthcare provider right away. Which brings us back to the fact that you need to know how your breasts look like and watch closely for any changes. So, whether or not to do self-breast examination is up to you, but please remember that self-examination cannot be the only diagnostic method that you use. Which brings us to diagnostic methods of breast cancer, the gold standard of which is, of course, mammography. The goal of mammography is the early detection of breast cancer, typically through detection of characteristic masses or microcalcifications. According to American Cancer Society, women between 40 and 44 have the option to start screening with a mammogram every year. Women 45 to 54 should get mammograms every year. Women 55 and older can switch to a mammogram every other year, or they can choose to continue yearly mammograms. And of course, these are just recommendations. For example, if you are at increased risk of breast cancer, your doctor may recommend more frequent tests. An alternative to mammography is breast ultrasound. It uses sound waves and their echoes to make computer pictures of the inside of the breast. It can show certain breast changes like fluid-filled cysts that can be harder to see on mammograms. Ultrasound is not typically used as a routine screening test for breast cancer, but it can be especially helpful in women with dense breast tissue, which can make it hard to see abnormal areas on mammograms. It is widely available and it does not expose a patient to radiation. So, dear ladies, let's take care of our breasts. Let's perform regular diagnostic tests, and if anything raises our doubts, we should consult specialists. In the next episode, I would like to tell you more about lymphedema, because you may be wondering, why are we talking about breast cancer in the physiotherapy channel? Well, unfortunately, many patients who have undergone breast removal surgery struggle with edema and end up in our physiotherapeutic hands. That is why in the next episode I will tell you more about upper extremity edema and how to deal with it after breast surgery. Thanks for watching and see you next time.